Welcome back to the Life Sciences Professional Podcast. I'm your host, Linda Robertson, and I'm here to introduce Aaron O'Donnell. And he has lots to share around balancing personal, professional success in the dental industry. He has been in the dental industry for over 15 years. I've known him a very long time. I'm happy to have him as a guest on our show, and I'm sure you'll enjoy everything he has to share. And please stay with us. So thanks, Aaron, for joining us. I really appreciate it. And you and I have known each other for a number of years, and we'll kind of touch on that a little bit. But, you've had a tremendous career in the dental industry, starting in sales and distribution and with the dental company, and then moving on to tier one dental implants, where you had a great career from sales into leadership. And that's where you and I met. I placed you there.
Yeah.
And, that was fantastic. And then now you're with a DSO organization, which we'll touch on that. So if you don't mind sharing some information about yourself with the audience, that'd be fantastic. Just a brief overview would be great.
Yeah. Well, I guess, I'm a London, Ontario, born and raised kind of guy. Started my career, I guess, after university in outside of the dental industry. I started in some marketing and some advertising and some business to business sales, and realized, from an early age that there's a lot of different ways to make money, and there's a lot of different paths you can choose to get where you want to be. And for me, it was all about how can I maximize my earning potential, but how can I also maintain a balance with my personal life? And that's really where I guess all of my decisions have been focused and based upon is how can I make that balance where, you maximize one without compromising the other. So it's been a really incredible journey, and very fortunate to have worked with some great people, some great leaders, and some great companies along the way. And gave me a really good and diverse background and a skill set to put me in the position that I'm in today.
Great. So throughout your career in the dental industry, going from like what we talked about, how have you approached learning in those different areas? Because they're quite different, right? Distribution, then going into implants, which is very specialized and totally different. You're working for a manufacturer, and you have to develop the skills as a sales professional, as a specialist. And now then moving over to DSOs. So, what strategies have you used to sort of help you in that area?
Well, you're very right. I guess the companies that I worked for are vastly different, and the strategy to the customer has to be vastly different as well. When I entered the dental industry, it was very much a transactional sale. It was price point. It was, how can I save $1 or 15 cents or 10 cents off of this item or that item? And that's a real different sales than it is to the implant world. So going from one to the other was a real challenge, and I remember actually being terrified when I took the job. I was like, okay, here we go. This is completely new realm for me. So what I did was immerse myself. I tried to become as much of an expert as I possibly can, knowing a very small segment of the wheel, I guess, in the dental industry was very helpful. And when you can start to, I guess, gain the confidence within that space, you start to become more comfortable. You start to become more of yourself. You start to become more relaxed, and things just flow a lot easier. And thankfully, the company that I worked for was very, very invested in some significant training for us. So, I joke with some of my former colleagues that, they weaponized us is really what they did. We thought we were good, but they really provided the tools for us to take it to the next level and to be more than just a salesperson, to be someone who can sure sell you whatever is in my bag, but how can I bring you some extra value? And that was really where I wanted to differentiate myself and where I had a lot of success doing. And that doesn't mean, bringing Timbits and coffees for the office staff. I mean, that's all fun and I like doing that, but it's how can I help my client achieve more and help them achieve their goals the way that I want to achieve mine. And when you're walking the path together, it's such a different experience than when you're trying to push somebody down the road than when they want to walk with you side by side. So to me, it's about bringing some extra value, making sure that you can be that person that they would think about, not just for whatever it is that you're selling. It's just, oh, I don't know about this. Maybe Aaron will have an idea. So they give me a call on things that I had nothing to do with, but because I'm out in the field and I'm knocking on doors and I'm networking and I'm at all these events, you get a better sense of what the bigger picture is instead of just being narrow casted into, what you have in your bag to sell them. So it's hopefully that answers your question.
Yeah. Yeah. Well, and I think that that's something that's missing a lot in sales reps. I will tell you, I don't even know the number anymore over these past 23 years of interviewing, but as a sales leader myself in the past, that's what differentiated, the top 3% compared to other sales reps. And if you become expert, like what you're talking about, and really get to know not just your products, but your customers and the industry and what's important to them, that's when, you're always employable, number one. Number two, you make more money. And number three, you really enjoy the profession you're in. And I see representatives that just don't get that, right? They don't understand why they're not making more money. They don't understand why they can't get a job. They don't understand why they're, not excelling in the profession. It's because they're really not invested, right? The same way. And they don't really learn the art of sales. They're not, really focused on the sales profession. So a lot of times I'll ask reps, and you'll hear me talk about this on different podcasts about what they've developed or tell me about their products, and they really can't, right? They're just skimming the surface, right? You've managed people like that.
Yeah.
And, it's to become expert in what you do. And once you've done that, you build that trust and likability and somewhat dependability from your customers on you, in that they'll want to reach out to you because they trust you and they think, you've got that expertise like you're talking about. When, as a sales manager, when you were in the implant world, because you were promoted obviously from being a top performer, what did you find when you were working with sales representatives, especially in that specialty? I mean, it's surgical, right? And a lot of times your representatives would be with the specialist, the dentist, as they're doing procedures, just there to guide them sometimes and providing some support. Even it's not that they're doing the procedures for them, but they want the support. What did you find with some of the representatives, that the skills that they really needed to be able to do that job well, that you identified when you were hiring them?
Well, to me, sales is, there's the hunters, there's the farmers, and there's got to be a healthy mix of that. But I think any good salesperson is a storyteller. And if you can't create the verbiage or the lore around the products that you have to help them, to help their patients ultimately, then you're not going to have the success. Because I can go and I can sell you an implant, for example, but if you don't have the confidence and your staff doesn't have the confidence in presenting that treatment to the patients to show them why that is the better option versus another procedure, then you're not going to have the success that you want. So it's not just about, yeah, I can go and I can sell it to you. It's about what's the next step. So there's got to be a plan in place. And in the sales world, at the start of every year, when you get your goals, you're like, okay, I crushed it last year. How the heck am I going to do that again this year? You got to start at the end and work your way back. At least that's what's been good for me, and figure out a plan to do that. And it's the same thing with when you're working with the dentist and all of my clients is, where do you want to be and how can we get there? And I'm happy to do anything and everything that I can to help you get there, but they've got to be as invested as I am with them, because there's an awful lot of time, a lot of education that these clinicians go through to be able to do these things. But if they don't use the skills that they've learned through the education and through the different courses and the different shadowings and all the things that we do to help make them comfortable, then they lose it. And I'm sure most dentists would agree, and most staff would agree, that people come away from a weekend course and say, oh, that changed everything. My perspective is different. But there was nobody else at the course with them. So they didn't have that I guess, that rush or that momentum back in the office to help actually facilitate the change. So if you don't have the plan to get there, then you may as well not even start. I mean, a wish is a wish, but a plan can, get you where you need to be.
And managing a team as well, how did you find dealing with them in terms of, there was a lot of evening things, weekend courses, Monday to Friday work that they had to do, to make the calls, helping them balance, because sometimes reps would get frustrated or, get disillusioned. How did you help them balance or figure out, the things that you have figured out in terms of work-life balance, professional and career? How did you coach them through that?
Very good question. And actually, I give a lot of credit to one of my former leaders who sat me down when I was in that, oh my gosh, what am I doing? I'm working, 80 hours a week and every weekend and evening, and I'm missing my kids grow up. And he sat me down, and I, I refer to this in my mind all the time, is let's break down your week, Monday to Friday. Okay, so what do you want to do in your personal life this week? Okay, your kids got hockey on Wednesday. Okay, we're going to block off Wednesday after or Wednesday late afternoon so you can get home, get fed, and get off to the rink. And what else? You want to go to the gym? Okay, you want to do that Monday morning, start your week off right? Okay, so we block that off. And then we went through this exercise of what's important to me first so that I didn't have to have that stress when I was going to knock on someone's door. So I've taken that approach with everybody that I've had the pleasure of managing and leading. Is let's put you first and put your family first, because I've read this years ago, and I'm sure you've seen it, and most people have seen it on the internet. But nobody on their deathbed ever said, "I wish I spent more time with the office."
Yeah.
And that to me just it rings true every single day. And I think by prioritizing what your needs are helps you shed that stress so you don't feel like you've got the weight of the world on your shoulders. Because if you've got stress coming from your targets, you've got stress coming from your clients, you feel like you're letting your wife, your husband, your kids down by not being a part of them, that that pressure is almost insurmountable. So if you can alleviate one of those, so you've got that calm, then you can focus. And I don't know, one of my lines that I like to say is you can feel the knot sort of unwind in your back and in your neck. So
Mhm.
to me, it's about always prioritizing. And for me, it's always been family first, always. And, hopefully I put myself in a position where that won't ever change.
And you know what? I think that's fantastic advice. It's something I followed for 23 years. And when that goes off kilter, work becomes very stressful, personal life becomes stressful, right? And I do something a little different that some people don't do, but the beginning of every month, I have something that I write down all of my work goals, my personal goals, my family goals, and that helps me refocus. So every month I see them, right? I have the key ones up on my board, but those are things that I write down to make sure, am I doing those things? And am I
But that
achieving
gives
them
you
by
the
the
path,
dates?
right? That's the
Yeah,
path
it
that,
does.
that gives
Yeah.
you the plan. So you start at the end and you work your
Yeah,
way backwards, and that way you can
that's
stay the
right.
course. And if you don't, I mean, you're going to get bumps and hiccups all the time for sure. But
That's right.
if I know where my destination is, I'm going to get there.
That's right. And you know what? If you're happy at home, you're happy at work. If you're happy at work, you're happy at home. And ultimately, when we're working for the organizations we work for, in order to help them achieve their goals, we have to be focused when we're there. And if we're distracted or, we're not focused, I guess that's the word I want to use, that focused on the goals and objectives of the day, the company's not going to achieve their objectives. Everybody that works for them needs to be engaged. And the only way to do that is to make sure we're not distracted. Now, there's going to be days that, that doesn't always happen, but, it is important. And your manager did the right thing, for sure, to when he saw that you were probably struggling a little bit, because there are different points in our lives. And we talked about this before we started, the beginning of your career, mid-career, and end career. And at those different points of our career, we also have different points of our professional or personal lives, which are, you may be single and then just get married, and then you have a family, and then your kids grow up and they they leave the house, you're empty nesters, and then you're almost at retirement. So at different points, both in your career, and your professional life might clash a bit. So, those things need to be taken into consideration. So
And
I
you're
hear
absolutely
you.
right. And, I made some pretty significant career changes based on exactly what you said. I remember, in my first role in dental world, I was a national manager. So I was on a plane for 2, 3 weeks a year, or a month rather. And I didn't realize what I was missing and, how much stress it put on the home life because it, you get so enveloped in what you're focused on and okay, I got to go out. I'm young, I'm hungry, I got to make a difference in the world and all that kind of stuff, which is all true. But I remember my wife telling me that my son started referring to the laptop as daddy because we were FaceTiming on. And that
Oh,
broke my heart. And I said, okay, I've got to figure out what my next move is because I don't want to be that guy. And, then I went from a national manager to a sales rep, local territory, and it was fantastic. And I got that balance, more control of my schedule, but then, started having some real good successes and started climbing the ladder, so to speak. And I remember when I was, away for a meeting about a meeting about a meeting, that seems to happen sometimes. I was out for dinner, and my wife sent me a video of my son at his Christmas concert, and he wanted to surprise me that he had a solo, and I didn't know a thing about it. And I was sitting in the steakhouse, and I just started welling up. I was like, I'm doing it again, and I didn't even see myself falling into that same trap. I was just, get a little bit more tunnel vision, and that was the moment where I said, okay, now I got to do something different. And I made another massive career change, even though I'd spent almost a decade, doing very well. It didn't matter because I knew that if I didn't prioritize my family, not that things were bad, but I could see them sort of heading in that direction. And if I didn't have the safety and like the pillars that my wife and my kids provide for me at home, then, whatever I was doing didn't make any difference. I could be, flipping burgers or I could be, at a corporate board meeting. But if I didn't have those people to come home to, then I didn't want to do what I was doing. So
yeah,
yeah, it was
that
it was
makes sense.
difficult, but like I said, family first always. And I've been very fortunate that my wife and kids have been massively supportive of me, and I wouldn't be in this position without them.
Yeah. And, but at least you had the foresight to make those changes, right? And to do that. Um, because before you know it, I'm telling you, they're out. They're living their
That's what
life.
people
It's
keep
so,
telling me.
yes. I mean, I still have one at home, which is thank goodness, but um, and you do miss you can't get back what you miss, I guess is
Yeah.
a good thing. And people need to think about that. And it is what it is. But one of the things I wanted to chat with you about is you've now joined a DSO, and maybe you could explain a little bit about that role and how you've taken your experience and now recruiting dentists. And when you're doing that, what kind of things you look for? Can you tell us?
Yeah, you know what? It was a big change for me, that's for sure. But I remember back when I first started in dental, when the big DSOs were in their infancy, and thinking, "Holy cow, this is a really novel idea." And the states had had it before, but I was, didn't really pay attention to
Yeah.
the DSOs in the states. This is 2008, 2009,
Yeah.
right? So, or maybe 2010, but. Um, I remember thinking, what a really interesting concept, and I like the idea of it. So it always sort of been on my radar as to just keep a pulse. So when in my first role, I was fortunate enough to get on the buy sheet, I guess, for the big DSO. So that was sort of my first interaction with them. And what I realized then was what I think a lot of people are starting to realize now is they're not just a big name or faceless corporation that is, I guess all suits and ties and all that kind of stuff. It's really interesting on the inside now, seeing how they really are patient centered. I mean, it's a business, of course, but the business doesn't compromise or sacrifice the patient care, and that to me has been really really impressive on what they have to offer. So I guess as far as what is my background and my skill sets and how does that translate into recruiting for associate dentists and specialists, it's given me the ability to understand where they are at different stages of their career. So if you're a new grad, what should you be looking for in the short term? Where do you want to be in 3 years, 5 years? Do you want to be a practice owner? Do you want to be an associate? Do you want to be able to, walk away at the end of the day from the office and go on vacation for 6 weeks to Greece because that's where your family is, and not have to worry about the staffing, the IT, the HR, all that kind of stuff that as a business owner, and you well know, that you can't just walk away clean and actually unplug for extended periods of time. It's not possible. So it gives me the understanding of where they're at and where they want to be and help guide them. And it's not just about, do you want to be a business owner? It's, what do you want to do? And, we're fortunate in the dental world, you don't just graduate and I'm a dentist for perpetuity. You have to take a lot of continuing education. You have to sharpen your skill set continuously. And thankfully, my company has a massive arm that provides that to them. So it's not just about knowing where they want to be. It's the same as I said earlier. It's about helping them make a path and a plan to get to where they want to be. And that, to me, it's very cyclical, and it doesn't matter what industry, what you're doing. It's more about finding the way to get to where you want to be. And I've been, I guess, very fortunate because now I can speak the language. I can talk the talk with them. I know the clinical settings. I know some of the frustrations that they find, not just with procedures, but with patients, with case presentations, with acceptance, with collections, with front desk, with everybody that's involved in the office. So it gives me more of a holistic approach to be able to help them. And when I'm posting for a job, it's not just, okay, I need a dentist at Smile Center down the street from me. I sit down and I talk with the office manager or the principal dentist or the regional manager, and we get to know the clinic. So what do you guys need? And a lot of people you'd be surprised, I guess I'll say, how many people don't really understand what their true needs are. And they just think they need a body to be able to do dentistry, but they don't look at it from the bigger picture. Okay, you're referring out 25 cases of this a month. I've looked at your production because we've got some really great reporting. You're not doing these procedures. Would it be more beneficial if we had someone to complement your skill set? If you want a new grad, are you okay at understanding that they're going to need some mentorship? They're going to need some help along the way. And some people think, yeah, I do want that. And then we place that person in there and like, I don't want this. This isn't
They're not supported.
and that's fine. That's completely okay. But we just need to make sure that it's not just the candidate that finds the right home. It's that whoever's in the office finds the right person to come in. And, work life, you spend more time with the people that you work with, generally speaking, than you do with the people outside of your work life. So you've got to be very selective, and you got to make sure that it's right for you. So it's not just about, yes, you can get this job and fill this role. It's about, is this going to help you maintain the balance that you want in your personal life, not just for the associate, but also for the office, and make sure that it's the right fit for everybody. So it's interesting in the fact that I've gone from, saliva ejectors to surgical to distribution and building offices now to this. So it's given me, like I said, a bigger picture view, and I try to impart that on everybody that I talk to, especially on the candidate side, but also from our practices side as well.
Yeah, and I've been doing it for such a long time that the key to this success is understanding that work-life balance and what they're looking for, and that it matches the culture and the demands of the organization, right? And the roles. And if you understand both and you match the right individuals, you win, right? They win, everybody does, and they're very successful. But it's when you don't really understand the objectives of the candidate, what's important to them, what are they trying to accomplish, not just the professional, but the personal.
Mm-hmm.
There's two sides of people, right? Just like we've been talking about.
Mm-hmm.
And you talked about the fact that, you've gotten into roles and they were the right roles in the beginning, but then you started to go up the corporate ladder. It would have been great if the organization internally had have really understood, you as an individual or any manager, any individual in the company, what's important to them. And if you're going into management, what kind of support or changes could happen so that people could be more successful in those roles. because
You're
it's great to
absolutely
be
right.
it's great to be a manager, or it's great to be a dentist, or anybody in an organization. Like right now you work remote, right?
Yes. Yes.
And a lot of people are asking for remote. Now you can't be remote if you're a dentist, and you can't be remote if you're a manager, like a sales manager, because you've got to be feet on the street working with your reps, right? And coaching them and mentoring. So there are certain roles that absolutely you need to be out, but there is some balance there. It's, when you talk about meetings, right? That's what kills an individual in a manager role, because not only are you out there working with your reps, but then you're going to meetings that, why are you even attending those meetings? Or, why couldn't they be done virtually as a group, especially nowadays, right? Just different things like that, that sometimes you're wondering, is any consideration being made to look at people and what makes them tick and what
Yeah.
makes them happy and how can we retain them, right? And I think your journey and the things that you experience really can help enlighten people to really step back and say, okay, why am I not happy? What are the tiny little changes, or maybe big changes, I could be making so that I could be more successful, both personally and professionally? And a lot of times it's just that, you're in the wrong job, right?
Mhm.
You're in the wrong company, the wrong job, or wrong career for that matter sometimes. Now, some people think, oh, I'm going to just start my own business. Well, trust me, honey, that's not so easy. I've been very fortunate to be successful, but even in my career, most people don't make recruiting past a year, and then they fail after two, and then after five, they're done. I'm a one percenter, but even in businesses in general. But you don't need to do that. You could find a great company to work for, like you have. You've been very fortunate to have three companies that suited your needs for a period of time, right?
Absolutely. And you know what? The one thing that just came to me when you were speaking there is when companies do recognize what that balance is and give you that flexibility to work remote or work hybrid or whatever the case is, or even if you're in the office, it doesn't really make a difference. But when they give you the ability to have the other side of your life balance, it makes you want to give more to the company. So you're more productive,
For sure.
and that
Yeah,
changes things completely, because then it's
yeah,
not just punching the clock, and it's not just I'm going to work. Okay, I'll be home at 4:30. I'll be home at 6:30. It's I'll be home
absolutely.
later, but I'm gonna really put my foot down and give it what I all that I have, instead of just going through the motions. And that's what a lot of people do, is go through the motions, and we've all been
Okay.
guilty of it from time to time, for sure. But for me anyways, when I have that nice home life and personal life balance, then I'll give everything I can to the company, because they've provided me an opportunity to give everything I can to my family.
Exactly. Yeah, I totally agree. And so where do you see things for you now? What's the next steps?
You know what? Right now, I think I have the best job in the industry. I really
Yeah,
do. I
good.
I I don't I don't see, unless something drastically changes, anything changing. What I would like to maybe dabble into a little bit more with this company is getting more immersed in the continuing education side of things, because I have a really strong passion for that, and I really enjoy putting programs together and helping people along their journey to get what they want. So I'd like to maybe have my hands in that to some extent, but for right now, I can walk my kids to school in the morning. I coach my daughter's soccer. I coach my son's hockey team. I play volleyball with my other daughter. It's really given me the best of everything. So right now, I could not be a happier person.
And what advice would you give somebody that wants to get into the dental industry? Um, new graduate, or somebody from medical or pharma or whatever. Advice would you give them? Um, because one of the things that I find is that sometimes they want too much balance towards, they to their personal, and don't recognize, okay, well, we've got to understand that, you're being paid to do a job, and it just doesn't, you know, it's not all let's just work from home, and there's give and take, right? You have to understand that the companies need you to be productive, and to help them succeed. So what advice would you give them to really think about, if they're going into sales, these are the things you need to be prepared for? And, sales is the best job in the world. I honestly, sales leaders, the medical device industry, I think is the best industry ever, whether it be dental or, acute care, medical device. But I really think that individuals can be disillusioned a little bit, or unrealistic, let's use that word. What advice would you give them if they're thinking of going in?
Well, I would say I would have to look back at what got me into a successful position. And any role that I started, I didn't take holidays for 18 months. That was usually my rule of thumb. I wanted to completely immerse myself in the company, in the products, and make sure that I knew everything inside and out so that I could be looked at as an expert. And that is a challenge for a lot of people. And when I say I didn't take holidays, I'd still, go on a Friday afternoon of a long weekend up to the lake or something like that. So you still got to have some balance. But I would say immerse yourself, be prepared to fail, and don't let your short-term failures build up. Use them as a learning experience. You've got to be patient as well as being hungry. So there's a balance there where, you can go and try to knock on someone's door. You won't get there they won't open it for 12 months, 6 months, whatever that time is. You got to be patient, and then you got to be introspective. So what can I do differently to make this person want to answer that door? And if you're just going in with a product flyer and you're going to be completely transactional, you're not going to have near the success that you can if you figure out a way to add value to what it is that you're selling. And that can be education, industry insights. It can be something very, very similar. I read in the news that this dentist is doing this in New York. What do you think about that? Just spark conversation and do your best to transform yourself, not into the sales robot that sometimes corporate thinks that you should be. Don't lose yourself along the way. You've got to this position because you're a good communicator, you're personable, you're outgoing, you're fun. Don't lose that and become a sales robot, because as soon as you do, then you're replaceable by whoever else walks in that door. You've got to be memorable, and you've got to have something that sets you apart from the others. And there's no simple fix, like I said, to finding out what that answer is, but you've got to differentiate. And one story that I like to tell is there's one dentist that I really wanted to land, and this is in the implant world, and I couldn't get past the front gate, the front desk for the life of me. So I walked in, just stop in, a couple times a week because it was kind of near my house, and it was lunchtime. And the front desk girl said, "Oh, he goes and feeds the ducks at lunch, so he's never going to be here. You got to come at a different time." So I said, "Okay, how am I going to figure this out? There's only 2 or 3 places that this guy could go near this office to feed the ducks." And I just started going and doing my admin work at lunchtime. I'd bring my sandwich and hope that I would pick the right day and the right time. And we got to talking. Eventually showed up. It was about 2 weeks later when our paths crossed. But it was just sitting outside, and it actually brought me back to a time where I was like, okay, now I'm enjoying this admin. I'm not, in my car in the rain or, trying to get dinner started. I get to sit and enjoy the work that I'm doing. And he got to see me as a person and not just the sales guy. I mean, there was a tactic to it, of course, but it also allowed me to be myself. And long story short, he came around and became a very good client and a good friend of mine. And it's just about thinking outside the box. You can't, like I said, you just can't be the sales robot that sometimes corporate wants you to be. Don't lose yourself, and always bring something extra to the table.
Yeah, that's great advice. And then of course, once you work hard and do what you're saying, always checking in and being present when you're with your family when you're there.
Absolutely.
And I think that's the clear message, that lesson you learned, and the thing that you continue to do. And I think we've all made that, but we've all done that. So I think it's really making sure that people understand it's really how to have that balance between, yourself personally, because I know you and I've talked a lot about, looking after yourself, going to the gym and eating healthy and having your family, balance, and then your career and managing that and doing things you want to do successfully and feeling rewarded. Because doing a job that you don't really like because you're trying to make your family happy, that's not good either. So I think the lesson that we're trying to really instill in people here is that you can have a balance
Yeah,
and do those things. So, I really appreciate you coming on, Aaron, because I know over the years since I met you, when I placed you in the implant role, and we've worked together. I've recruited for you that and stayed in touch. This has been fantastic, and I really appreciate you coming on the show today.
that's been my pleasure. It was, I think, 2013 when we first met,
Yeah,
and you've been, you've been a great resource. You've been a great friend, and it's been absolutely my pleasure to come on. So thank you very much for
yeah,
asking, and thank you very much for having me.
yeah. You're welcome. Thank you.